Welcome to the press briefing. On stage, we have Dr. Zhang Zhokwan, Head of Communicable Disease Branch of Center for Health Protection, and also Dr. Larry Lee from Hospital Authority. Dr. Zhang will give us a latest epidemic situation. We have 579 cases returned by PCR and 464 tested positive by RAT, a total of 1,043 cases. Together with previous cases in the fifth wave, we have a total of 1,270 cases, 1,290 cases returned by PCR, and 441,470 by RAT. Among the 579 cases tested positive by PCR, 118 came from the Hospital Authority, 151 from the Center for Health Protection Public Health Laboratory, 310 by private laboratory. Our laboratory has done genome analysis. No L452R positive cases were found. 337 tested negative to L452R suspected Omicron cases. For 6 cases, either the viral load was too low or results was pending. We've got 23 imported cases, 15 arriving in Hong Kong yesterday, involving 6 flights. 5 cases came back by ET608, 2 on QR818, 4 on SQ494849, 2 on GA860, and 2 GR8600, and another on TR980. And we had 8 cases that arrived earlier. We have no new outbreak in care homes. In existing care homes, we've got 17 cases involving residents and 6 involving staff members, and 21 RCHEs and 5 RCH for persons with disabilities. Now, for death cases, another 54 cases were reported by HA, one with positive result. 8,730 cases from HA, together with 59. In the fifth wave, we have got 8,789 death cases. Among the 8,789 cases, 3,610 were male, 5,179 male, aged from 11 months to 112 years old, median age 86. Now, the death rate is about 0.74%, and for the other analysis, they're very much the same as previously reported. Now, in the laboratory of CHP, in one of the cases, there was a person returning from South Africa through Ethiopia on ET608 on the 6th of April. After genome analysis, he was found to be carrying BA.5 variant. He was positive when tested at airport. The third day 4 PCR and our AT tested positive on the 8th of April, and a minor discomfort on the 9th, and he's fine now. WHO said that BA.5 variant is one of the branch of the Omicron variant that have to be monitored, and the public health impact has yet to be investigated, whether it is more transmissible or what. No detailed information is available. BA.5 has been identified in other countries and will continue to monitor the situation. That's all from me. Dr. Lee, can you tell us the situation with HA? Thank you. In HA, we have got 8,702 confirmed patients being treated in public hospitals, Northland Town Infection Control Center, and also AWE. 7 critical cases were reported yesterday. 7 had no vaccination record, 1 with 1 jab, 2 with 2 jab. 13 in serious condition, and 58 critical patients being treated in ICU. As at 00 hours this morning, in the past 24 hours, 33 tested positive patients passed away, 17 male, 16 female, aged between 57 and 101. 18 of these 33 came from care homes, 25 had no vaccination record, 8 with 1 jab. 32 are over 65 years old. 1 was below 65 years old, and I'd like to elaborate on this case. As a 57-year-old man with 1 shot of vaccine, he had a liver disease, and he had esophagus cancer. In 2021, he received a radiotherapy. He lived in a care home. He attended the A&E department of Eastern Hospital and was found that his feeding tube was detached. In early March, he was positive. And when he was admitted, he was negative using RAT. His X-ray showed that there was obvious metastasis of his cancer. His condition was far from desirable. He had electrolyte imbalance involving calcium, sodium, and potassium. We gave him different treatment, but then his situation continued to deteriorate, and then he passed away on the 13th of April in the evening. And as for lag behind cases, in between the 3rd of March to the 12th of April, 21 patients passed away, 8 male, 13 female, aged 80 to 102. 1,507 patients were discharged. 3 were screened positive, and then 3 were regarded close contacts. We had 21,769 staff members infected, and 20,738 have returned to their duties. Q&A. I'm from Dot News. First question, starting from tomorrow, we have the Easter holidays. There will be more circulation in the community. What measures do you have? What has the CHB got to say to the community? Should the epidemic rebound? And do you have any indicator for you to tighten the social distancing measures again? And for RAT, for students, schools are worried that anxiety and inappropriate method may affect the accuracy of the results. What advice do you have for them? This morning, the chief executive mentioned that we do not have any hard indicator, that is what measures to take depending on the extent of the situation. The relaxation of measures is a balance of different considerations. So we expect that there may be transmission risks and there may be some rebound of the pandemic. While we enjoy the relaxed measures, please remain vigilant. In cases where you can wear a face mask, please do so and observe personal hygiene. The second question was, well, the purpose of RAT. Well, we want school children to do that before returning to school because results can be obtained very quickly. If we talk about a saliva sample, then there is a lag. There is a time lag, and then you did it yesterday, the result may not be available today, but you have already attended school, and then you may be found positive afterwards.
A couple of questions, if I may. Dr. Chuang, on the 29th, the social distancing measures will be relaxed. The government seems to be saying that the government has not given up on the compulsory universal testing. Now, with more people out and about, there would be higher mobility. Would that present greater difficulty for compulsory universal testing? And if people are kept at home, it would be easier. Would that relaxation cause greater difficulty with regard to CUT? Another question for Dr. Lee. Now, for the QEH part of the hospital will be admitting non-COVID patients. Can you give us the breakdown between COVID and non-COVID patients? How many COVID patients are there, and how many non-COVID patients are there at QEH? And in terms of infection control, is there any arrangement different to the situation before? And will this be causing a lot of in-hospital infection? Now, things are dynamic. It is likely to be converted back to a COVID hospital if necessary. Now, what criteria do you adopt? How many patients do you need for it to be converted back to a COVID hospital? For other designated hospitals, would they be progressively admitting non-COVID patients as well? And Lok Ma Chau Loop Emergency Hospital has been completed. And what is the progress so far? And the wastage of doctors, it is 6%. Kowloon Central cluster 39 doctors have left. The $180 million retention scheme, has it been effective in retaining the healthcare manpower? Right, the relaxation of the social distancing measures will cause some degree of transmission risk. We will monitor the situation. We have balanced different considerations. The CUT is a comprehensive plan. I'm sure the government will announce the details in future. The QEH is a designated hospital. There were a few thousand COVID patients in different hospitals. Now QEH has about 500 COVID patients. We all understand that QEH is right at the heart of Kowloon. It is one of the busiest hospitals in Hong Kong. Its A&E admits a lot of critical cases. We can't really ignore the needs of these patients. When we admit the COVID patients, we will still monitor the situation. It would be hard for us to name a number to decide how we're going to be changing the arrangement. We have to be tactical. If the number of beds, if the beds have to be converted, then in terms of hardware and manpower, we can certainly do so. And in terms of infection control, we do have a team that would be offering their input. Now, in relation to manpower, the wastage is 6.9% for doctors or 8.2% for nurses. The HA is very concerned about the manpower situation, so we are improving the situation on a number of fronts. We are recruiting full-time and part-time manpower. We also have the locum office, which is recruiting additional manpower. In the fifth wave at the AWE and HKICC in North Lantau Hospital, we do have a lot of dedicated part-time healthcare workers from the private sector who are helping out there. We are having a lot of team spirit there. In this fifth wave, our professionalism and our core values, I'm sure, will attract a lot of healthcare workers to join us. The speaker not speaking through. For the other designated hospitals, different clusters would make their own arrangements. They do designate certain floors for COVID patients. I don't think we can have any sweeping generalization there. I don't have much information about the Lok Ma Chau Loop Hospital. English question, lady at the back, please.
Good afternoon from the South China Morning Post. Some projections have daily case numbers in the 500s by phase 1 of reopening on April 21st. So will the Center for Health Protection start doing extensive contact tracing like before, given that leave home safe is a must to enter specified premises? And with students and teachers asked to do RAT daily to go back to school, have authorities thought about the amount of waste this will generate and how will it all be handled? And regarding the BA.5 case, what symptoms did the man have? Was he sent to hospital or kept at a designated quarantine hotel? If the former, how long was he in the hospital for? And was the variant discovered before he was discharged? Thank you.
We don't have any projections of the numbers that could be dropped down. Of course, we hope that the numbers will drop down quickly. We do not have plans for changing our policy at the moment. For the rapid tests, I think it is essential to to ensure the students can continue to go to school and to prevent outbreaks in the schools. That's why we need a rapid test, at least in the initial weeks, for the students and teachers to try to minimize the risk of outbreaks in the schools. For the case of BA.5, I would like to elaborate that for this BA.5, they have a characteristics that they have also a L452R positive, so it's a L45R positive Omicron. So he developed fever, low-grade fever on 9th, and some cough and headache. And he stayed in the Regala Skyline Hotel, and he's still staying there. But according to our interview, he recovered already. I mean, he has become asymptomatic. And he was detected during his stay in the designated hotel. That's why he was transferred to the isolation hotel.
Next question, please. Lady at the back, please. Now, for the imported cases, how many of them were picked up by PCR test? How many by RAT test? Now, for the South African case on April 6th, what are the symptoms? Any side effects? And for BA.5, where did he get the variant from? What organization to represent? TVB. Now, for the imported cases today, all of them tested PCR positive. That the case that I referred to, on day 3, he tested PCR positive, and day 4, apparently this is another case. For the imported cases today, all of them are PCR positive. Now, regarding the BA.5, on day 3, he tested PCR positive. On day 4, he tested RAT positive. And by the time the results were known, he had light fever. He had the test on the 8th and 9th. He had a bit of cough and headache. He has already recovered. You probably know that for BA.5, it originated from South Africa. And this person came from South Africa. BA.5 was prevalent there in South Africa.
The lady over there, I'm from Mingpao. Dr. Cheung, for that patient with BA.5, was he in contact with anyone in Hong Kong? Do you have any special contact tracing arrangement for that? For rooms in the same floor of the hotel, anyone tested positive? I'd like to know whether he is now negative. Has he been discharged? What special treatment has been given to him? And what is the treatment protocol for this case? And I'd like to know the sources of from the 23 imported cases today. And for class resumption arrangement, there will be social activities. Now, for dining and also local tours, what will be the quarantine arrangements? Now, usually only household contacts have to be quarantined. What will be the arrangement for those premises? Now, I'd like to know whether there is an update on the prescription of the new oral drugs and the special traditional Chinese medicine services. It was said yesterday that there was higher demand. Can you tell us the number of places available today, and whether you have statistics for Chinese medicine services for RCHGs? Now, on the same floors of the patient, rooms on the same floor of that patient, we have to follow up, but results are still pending. On day 4 or day 3, when he tested positive, he was sent to Regalia Sky City Hotel, and he had low fever. He had recovered, and he did not need to be hospitalized. Now, for imported cases today, arrivals yesterday, they came from Indonesia, Australia, the UK, Thailand, Singapore, Australia. Yes. And earlier, there were people from the US, South Korea, Greece, Indonesia, Portugal, and the Philippines, etc. Unless the number of cases has dropped to a very small number, otherwise we will only quarantine household contacts. Speaker is off mic. Now, we'll follow up on flats near those confirmed cases. We'll ask them to do more frequent testing. Now, HA, on prescription of oral drugs, HA formulates the protocol and also reference information. So I do not have any figures as regards the registration from private GPs. Now, for RCHGs, we started TCM services for RCHGs in mid-February. For confirmed cases and also staff stationed at those centers, we provide online consultation of TCM services. We have served 216 RCHGs, and we have served 5,700 number of consultations. And as for the clinics in 18 districts, in February 2020, we launched a tripartite consultation services covering NGOs and local universities. We provide 10 free consultations. But as we all know, the fifth wave is very serious. There has been a rapid surge in demand for TCMs. In the past, we were serving 30 to 50 patients per day, but now it has since soared to 1,500 per day. So these clinics are finding it difficult to cope, but we will boost our service to cope with the rising demand. We ask for the public's understanding. We will work with the NGOs and universities so that we can boost our services to take care of those who need them. Next. I'm from independent media. What is your view of the recent trend of the pandemic, Dr. Zhang? For a long time, the government hasn't announced the results of sewage surveillance program, but then the number of buildings subject to mandatory testing is rising. Why is that? Now, there is a downward trend for confirmed cases and for results of sewage surveillance program. We have less than 1% of buildings requiring mandatory testing after going through the program. Of course, for mandatory testing, we'd like to identify more cases. So for buildings with more cases, we will introduce mandatory testing. And we still have capacity in testing. The journalist at the back, I'm from HKET. Regarding the 24-year-old man, what is his CT value? Now we have a dozen or so confirmed cases. Do you expect that we can have a 3-digit number in terms of confirmed cases? Now, people require 3 shots of vaccines to go to cinema, but not so for restaurants. In fact, how do you assess the risk of watching a movie? People do not check there. And for bars and pubs, they cannot resume business under the new social distancing measures. And what is the risk of infection in bars? How come they cannot resume business? The CT value of that gentleman is lower than 30, but I don't have the exact figure with me. Now, I think restaurants and cinemas are a bit different. In restaurants, you go there to eat, and most people will have to eat in restaurants if he is eating outside. But for cinemas, well, the main purpose to attend a cinema is to watch a movie and not to eat. If people really want to eat in a cinema, then they should have received 3 jabs. I speak of a soft mic. That I cannot be sure. It depends on the trend. We are on a downward trend. There is always hope that we can have less than 1,000 cases per day, but then there are bound to be ups and downs. Whether tomorrow for sure the number will be below 1,000, I cannot guarantee. This I'm not sure. Next, the gentleman behind. I'm from AM 730. Regarding Omicron BA.5, can you elaborate on L452R? Has he got any companion arriving in Hong Kong? And for contact tracing, apart from tracing the fellow guests in the same hotel, what about fellow passengers on the same flight? Will you step up contact tracing? And for the young patient who passed away, he was positive in March. Can you tell us the exact date of positive, negative? And have you has that exceeded the criteria of making an announcement within 28 days of positive? Now, usually L452R is found in Delta, and for Omicron cases, usually they are negative to L452R. But in this case, he was positive to L452R. This is known to WHO. So if we have identified L452R cases, we'll check whether they are Omicron cases. It's not that all L452R positive cases are Delta. We have to do full genome analysis to confirm. BA.5, I think that applies to both BA.5 and BA.4. It's just that at that particular location, the virus is a bit different. He was not accompanied by any other passenger. Now, all arrivals in Hong Kong have to be subject to a series of testing, and on the same flight we have not seen a large volume of confirmed cases. Regarding that 51-year-old man with esophagus cancer, he was tested positive on the 2nd of March. He attended the A&E department of Eastern Hospital. On that day, RAT was positive. As regards the exact date, I don't have it with me now. I can give it to you later. Any other questions? He was not admitted. He is now in a quarantine hotel, isolation hotel. Speaker was off mic. For imported cases are sent to Regalia. I think that's the first case we have identified. Before that, he stayed in Bridal Tea House. The press conference ends here. Thank you very much. Come again. The speaker is off mic. Hugo, I'll let you have it afterwards. I don't have this information with me now.